Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in our Conversation with Cancer Experts series, we have Dr. Jesus Gonzalez Lugo, Assistant Professor at Kansas University Medical Center in the Hematological Malignancy and Cellular Therapeutics arena. And we're going to talk about a drug that is expected to be on the market in the near future for myelodysplastic syndrome, Imetellstat, and Dr. Lugo will tell us how he intends to use it in his practice. So welcome, Jesus.
Thank you very much. I'm very happy to be here.
So before we get into the discussion on the drug, I just want you to help put in just very general, broad strokes, how you segment your MDS, and we'll talk a little bit about what we have to offer these patients today, and then get into a deep dive on Imetellstat. So how do you segment your MDS?
Sure. So as we have it here, MDS, first we have to define what MDS is. So I would have to say that MDS has three main components. And MDS has ineffective hematopoiesis. MDS has cytopenias, which is low blood counts. And also it has a risk of progression to acute myeloid leukemia. Those are the three components of this. And low risk basically are patients that mainly have the cytopenias, which is the low blood counts, mainly anemia, which is the most common thing that these patients have. And the high-risk patients are the patients that have the more risk to develop acute myeloid leukemia. We can do this by several risk scores, but that is mainly the thing. And the low-risk patients are the ones that many times we treat their symptoms, and the high-risk patients are the ones that we either transplant them because they have to go to an allo stem cell transplant, because that is the way that we can detain their progression to leukemia, or we have to give them other types of medications such as azacitidine or decitabine, so we can decrease their progression.
So obviously, we're going to hone down more today in this discussion to the low-risk MDS subset. So can you just give us just a broad general overview of how you approach your low-risk MDS?